I am Stephanie Wierzbicka, your host. We have Tiffany Schubert with us today, world-renowned fall expert, who's going to really take an opportunity to educate us on why falls happen. Now, before I go ahead and turn it over to Tiffany, I do want to first applaud all of you for attending. I know that many of you, this is your first time doing anything like this, and I know that you're here because you're looking for solutions. And so personally, I want to let you all know that I too have experienced the devastating impact that falls can have on seniors, and have learned that through that experience that, first of all, falls are not a normal part of aging, and that there are steps that you can take to manage your risk factors. So even though the data tells us that 1 out of 4 older people over the age of 65 fall each year, doesn't mean that you have to. There are specific things that you can do to reduce your chances of falling that you're going to learn about tonight. And I really want to encourage you to consider what we'll share, because doing so and taking the right steps to prevent yourself from falling sooner rather than later can help you stay independent. So without further ado, I want to go ahead and turn it over to Tiffany Schubert, who's going to start reviewing what some of these risk factors are, and then how we can start looking at how to manage them. Tiffany?
Thank you. Thank you so much. And I am so grateful to Stephanie and ComForCare to provide this opportunity, because we don't get a lot of opportunities to talk to the public, and it's actually a big failing on the researchers' part. So I also want to raise just a little bit of awareness. Yesterday and today were actually National Fall Prevention Awareness Day, and that was an initiative that was started by the National Council on Aging and by Lynn Beatty 11 years ago to really start raising the public awareness around falls. So I don't think this could have happened today without that hard work 11 years ago. So just a big shout out. So Stephanie already gave the kicker away on this one, but you know, before just a few minutes ago, or even now, ask yourself, do you really feel that falls are a normal part of aging, that they're inevitable, that they're just part of that typical conversation you have with a friend? Oh, my mom fell. Oh, my dad fell. Oh, my neighbor fell. And just, you know, is that right? And the answer is no, they are not part of the aging process. They are something that happens, but they're also something that we can take the steps to address. Go to the next slide, please. I'm not sure if I can drive. Ooh, can I drive? There we go. And the other thing I wanted to point out is that, believe it or not, in the younger generation, in the 45 to 64-year-old generation, if you look at the rates of falls, they actually fall just as much, if not more, than the 65 and over population. So again, this isn't a unique thing. The big difference here is that the older adults, especially individuals who are really over the age of 80, have a much higher risk of experiencing an injury with a fall, and in general the experience of a fall has a much greater impact on them. Next slide. So second question for you all to be thinking about. So the number one reason why older adults fall is due to poor eyesight. Is that a true question or a false? Next slide. So the answer is false. And actually, when you look at the data, what you see is the main reason why older adults fall is due to leg muscle weakness. So you look at that and you go, huh, that's something we could probably fix. And the answer is yes, that is definitely something we can fix, no matter how young or how old you are and you feel. One of the reasons why I got into the field of aging was I read this fascinating article in the early 90s that was a research intervention where they took nonagenarians, the average age was 94, and they had them lift weights. And what they found was the nonagenarians gained as much muscle mass as the 30-year-olds when they lifted weights. And it was one of the first studies ever to show that, and I thought it was fascinating. So, but I also want to call out that even if you're strong, you still may experience a fall because there's multiple risk factors that contribute to your fall's risk. And we're going to spend the majority of the night really talking about those risk factors and what you can do about them. Next slide. So I want to introduce something called the Stay Independent brochure. And this is a brochure that's available at ComForCare. It was originally created by the Centers for Disease Control. It's also available on their website. And the thing that is so cool about this brochure is that it allows anyone, including yourself, to assess falls risk. So I want you to think about this brochure the same way you think about prior to COVID, going to a pharmacy and like sticking your arm in the blood pressure cuff and checking it out. Like, it didn't take any special training for you to do that. It took a machine that knew what to do, but you didn't need a nurse to take your blood pressure. The machine did, right? That's what you want to think about this brochure like. No special training, just asking a series of questions to give some insight as to what are your risks for experiencing a fall. So we're going to go through these questions this evening. Next slide. So every question is a yes or a no, and I would really encourage you to write down your answers. And if you don't want to write down your answers, you can write down your score, and I'll give you the numbers as we go. So the first question we have for you all tonight is, have you experienced a fall in the past year? And if you answer yes, you're going to score yourself a 2. And if you answer no, you're going to score yourself a 0. So why is this important? Well, we've been studying falls in older adults for decades. And one of the things that we know, and it's one of the most annoying things, honestly, in my opinion, is that if you have already experienced a fall, your chance of falling again is much higher. So I find it annoying because it's like, I want to get ahead of that. Like, I don't want you to have the fall in the first place. But what we find is that if an older adult falls, there's a certain portion of the population that will then start limiting their activity because they're worried they're going to fall again, and then that gets them weak, and then they experience another fall. Or they experience that initial fall because there was some sort of health condition that happened. So again, so this is just one of those events that we have to ask about. And all you need to think about with this question is, yeah, I have experienced a fall. Okay, that's a bit of a warning sign. And hopefully it's a gentler warning sign than like having a heart attack, right? I mean, it's just you've had that fall and whoa, I got to start paying attention. Next slide. So the next question is, I use or I have been advised to use a cane or a walker to get around safely. Okay. If you answer yes to this, you're going to score yourself a 2. If you answer no, you're going to score yourself a 0. So why is this important? Well, typically, if you're using a cane or a walker, or if someone's recommended that you use a cane or a walker, it means that you're looking a little more unsteady. Now, I want to be a little careful with this because occasionally we get to this point of like, oh, I'm a little unsteady, I gotta go get a cane. That isn't necessarily the very first line of defense. You learning how to use a cane, learning how to use a walker is actually a skill, and you want to work with somebody to make sure it's the right size and it's the right fit and it's the right device for you. So when you look at this question, that doesn't mean I need to go get a cane or a walker, but again, it's a question to alert you that, you're not looking as steady as you should. Next question. Next slide, please. All right. So sometimes I feel unsteady when I'm walking. And if you answer yes on this one, you score yourself a 1. And if you answer no, you score yourself a 0. So why is this important? Okay, so this is sort of a no-brainer, right? If you're feeling unsteady, you're probably having some problems with your balance. And what I really encourage you to do is not look at this as a negative thing. Not look at this as I'm feeling unsteady, I better sit, or I better hang on to things, or I am, again, we're in this weird kind of space. So normally I would say, or, I'm not going to go visit my friend. We'll probably visit our friend either anyway. But what I want you to do is, if you're starting to feel like this, that should be empowering for you to go say, hey, I'm having some issues. I need to go talk to my physician. I need to go work with a physical therapist. I need to get stronger. This is my body's way of telling me something is going on here. Or this is my caregiver, the person I'm taking care of, their way of telling me, we got to address this. Next slide, please. So next question is, I steady myself by holding onto furniture when walking my home. So can you see there's sort of a theme here going on around strength, balance. If you answer yes, you score yourself a 1. If you answer no, you score yourself a 0. Once again, this is a sign that your body is saying, hey, we're having some issues with our balance, our strength. We need to do something to get stronger. Next slide. I'm worried about falling. If you are worried, score yourself a 1. If you're not worried, score yourself a 0. Sometimes people get a little stuck on this one because they're like, but I should be worried. I should be concerned. The fact of the matter is you should be aware, and you should not challenge yourself in a situation that's not a good idea to challenge yourself in. I always like to talk about the icy sidewalks. If it's icy outside, I don't care what age you are, you're probably gonna slip and fall. You know, that's the time you wanna stay in. But if you find that you are so anxious and you're so worried that you're gonna fall that you stop doing things, that is not okay. You should be confident enough in your mobility abilities, and the people around you should be confident enough that you are able to participate in the activities you want to participate in. So this fear of falling is real. There's actually really fabulous evidence-based programs specifically addressing fear of falling. One of them is called Matter of Balance, where it leads you through the whole process of what really should you be worried about, and really what should you be aware of, but not limit yourself. And this is really important. A lot of times as healthcare providers, we get super overprotective of our patients, and sometimes we give them the message they shouldn't do things because it might hurt them. You know, you need to be able to do the things you want to do and live the life you want to live. So just being very aware that if that fear is getting in the way, we need to address it. Next slide. I need to push with my hands to stand up from a chair, okay? I have a standing desk and I have a bar stool, so I can't really show this, but if you're doing this to get up out of the chair, your arm muscles are doing all the work, not your leg muscles. And this is a fantastic test. Can I get up out of a chair without using my hands? You all should be able to do that. And honestly, you should be able to do that 5, 10, 15 times in a row. And if you can't, it's a great exercise and a great goal. Our legs should be strong enough to get us up out of a chair. If they're strong enough to get us up out of a chair without using our arms, that's a good sign that they're strong enough to keep us upright and standing. So if you answered yes, it's a 1, no is a 0. Next slide. I've got trouble stepping up onto a curb. Same thing. So this is a little bit trickier, right? Because stepping up onto a curb means you got to pick one foot up. You got to have the strength to hold yourself up. You have to have the balance to stand on one leg. You have to have the vision ability to see where that curb starts and the street ends and where your target is. Pretty complicated. You still should be able to do it. And if not, time to go see someone. Yes is a 1, no is a 0. Next slide. I often have to rush to the toilet. Oh God, this is a weird one. What's that all about, right? So you got a couple things going on here, all right? So if you're rushing, you may be having some issues with incontinence, all right? Incontinence is, again, not a normal part of aging, something that we can actually address within physical therapy, something you can address also with other healthcare providers. The concern is that if you are rushing to the toilet for very good reasons, you may be less careful, and that can increase your risk of falling. The other thing is that sometimes when people experience a lot of incontinence, they tend to get dehydrated. That can also increase your risk of falling. So you can see how this gets really complicated really quickly. And it's also nice just to have this one question and go, yes, no, okay, I got to do something about it. So next, oh, perfect. I've lost some feeling in my feet. Okay, so this is sort of makes a little bit of sense too. If you have lost feeling in your feet, you don't actually know where your feet are in space. There's a lot of reasons why this can happen. For some people, it's a little bit of a normal part of aging where the very little nerves at the very end of our nervous system that are in our toes and in our bottom of our feet, as we get older, they're just not as effective. They don't carry information very well. We also have issues if people have diabetes. This can really have a huge impact on the quality of the information that's gathered by the feet and sent to the brain. And then there's a multitude of other things which can really contribute. But if you do not know where your feet are when you're walking, it is so difficult to maintain your balance. And again, this is something we can address. Next slide. Oh, medications. Oh, this is always a tough one. I take medications that sometimes make me feel lightheaded or more tired than usual, okay? And on all of these, yes is 1, no is 0. So a lot of times, we tend to use medications to treat every single medical condition. And sometimes, as a healthcare provider, and I can't actually do this as a PT, so just know that, but what the research says and what pharmacists say and what physicians say is that sometimes we're just prescribing the medication to treat that particular condition or whatever symptom is being experienced, but we're not prescribing medication looking holistically at the human being. And for older adults, there are so many medications that are commonly prescribed that actually increase the risk of falling, that make people feel lightheaded, that make people feel more dizzy. And so I really encourage all of my patients and everyone I talk to be extremely mindful about the medications that are prescribed. Talk to your physician, talk to your pharmacist, show them all the medications you're taking. And the goal is to get on the least number of medications possible at the lowest dose. And you would think, as healthcare providers, we would be really on top of this. But the fact of the matter is, we're not. There's not a lot of education in school about this. And so we really need to be working together and collaboratively. I've educated countless physicians about, hey, certain medications not okay for older adults, or did you know that this person was also taking Tylenol PM to help them sleep along with sleep medications that are out there. So I mean, again, you just have to be extremely aware and proactive. Next slide. Same thing. I take medicine to help me sleep or improve my mood. Very similar. A lot of the different medications that we take to help us sleep really are strongly correlated with increased risk of falls. And we have to be super, super careful with antidepressants as well. Antidepressants are incredibly fantastic, but again, with older adults, we have to be really selective as to which ones are prescribed. Otherwise, they can have significant negative impacts. Mm-hmm. Next. Last one. You guys hung in there. I often feel sad or depressed. So, really? Related to falls? Yeah. So what happens is, if you think about depression, is that our entire nervous system in our brain is depressed. We're not reacting as quickly as we used to. Everything's a little slowed. We're not as engaged. And so basically you get sort of this double whammy of oftentimes when people get depressed, they're not engaging, they're then suddenly getting weaker, their nervous system is slowing down because of the depression, and then a lot of the medications that are commonly prescribed also increase falls risk. So again, it's just something to be very aware of. And as you can see, falls are sort of this incredible insight into the person as a whole. I mean, we're getting all of this information just from this one questionnaire. Next slide, please. So, okay, so that stay independent questionnaire that we just went through was designed, tested, and validated on community dwelling older adults. What the heck is a community dwelling older adult? It's a fancy word for just somebody who lives independently in their home and engages in the community with minimal assistance. It wasn't designed for anyone who's living in a skilled nursing facility or institutionalized, or somebody who's recovering from a major injury. Wasn't really even tested on older adults who are more frail. And we're bringing this up because we just walked through those 12 risk factors, but they're only part of the picture for someone who is recovering from a major injury or a major illness, or who has dementia, or I saw a quick posting about traumatic brain injury. Once we start getting into these highly complex situations, believe it or not, the risk goes up significantly. So when we start to see issues with incontinence, when we start to see issues with uncontrolled diabetes, any major change in health status, urinary tract infections, delirium, and then if we start having compromised nutrition, all of these things, suddenly they just get accelerated, especially if you're more frail. So that's when when we start seeing these type of issues, then we really want to go towards more of a medical management model of what's going on. Let's get nursing involved, let's get PT involved, let's get that patient as stable as possible. And then let's make sure that they're doing everything that they need to do and they're leveraging their caregivers and everybody's working as a team to get that older adult on their feet and active and strong. So it's hard, and you guys are all doing an amazing job. And the main thing is being aware so you know when you can advocate and start to do things. Next slide, please. All right, so now we get to the management part. All right, we told you all the bad news, now we get to the good news. So the first thing is, if you can, take a moment and just score yourself. Where are you at? And I'll give you a moment before I spill the beans about what the scores are. But just add up all your yeses, and remember the first two, question number 1 and question number 2, are worth double, and then everything else is worth 1. And then if you score greater than 4, you are automatically at a higher risk level for a fall. If you score less than 4, you're still at risk for a fall. We all are. My sister was joking with me the other day. She was playing with her son, and they were like playing boxing, and she fell down, and her son thought it was hysterical that he knocked her out when he didn't even touch her, but it was really funny. But it's really important just to be aware that even if you score at low risk, you still have to be working on your strength, working on your balance, doing those kind of things. Okay, so what if you scored more than a 4? What do we do? Next slide. So this is from the National Council on Aging, and here are tricks and tips of things that you can do every single day to manage your fall risk. And again, thinking about blood pressure, for those of you who have hypertension, for those of you who have diabetes or any other chronic disease, you manage it every day, right? And if you don't, it's a problem. If you forget to take your blood pressure medications, you're not going to be benefiting. If you don't manage your blood glucose level, you're going to be having issues. That's the same kind of mindset you need to get into around falls. So screen yourself at least once a month. And that might seem excessive, but if you start screening and tracking, you can really see, oh my goodness, it was winter time. I decreased my activity, and look, I suddenly couldn't get out of a chair without using my hands. How crazy is that? So it just gives you that information, then you can really start staying on top of things. Find a good balance and exercise program. Okay, this is hard to do right now, right? But there's lots of things you can actually be doing. At home, standing up without using your hands out of the chair. Practice standing on one foot, hold onto a counter and stand on one foot and then let go. Little things like that. There's also amazing virtual resources out there. So in particular, the YMCA and Silver Sneakers they have really great virtual programs available that are free to the public. You don't have to be a YMCA member. You don't have to be a Silver Sneakers member. Lots of really cool things going on in that space. And then when we're back into more of a social situation, looking at what's at your senior center, what are the evidence-based programs? You've got fabulous programs available in the community. Go out and find them and use them. And by evidence-based means that you do this program and it's proven that you will improve your strength and balance. Talk to your healthcare provider, loop them in, and if they're not interested, make them be interested. Tell them about your concerns and what you want to do about it, educate them. Definitely stay on top of your medications like we talked about. Check your vision annually, really, really important. If you are wearing bifocals and if you're finding that you're starting to look down because you're getting a little worried about where your feet are, just be very aware that when you look through your bifocal, you're looking through the magnifying section, and it can really mess up your understanding of where that curve is and where that edge is. Work on your home safety. And get everybody engaged. Falls is not, we have to be able to talk about it and talk about it in a productive way, not in a scary way. Next slide. Oh, and find a home care partner. That was the most important one. I'm sorry.
It's true. And the reason for that, honestly, is that we say fall risk management is a team sport. And it's really important to find the right teammates to help support you and create a safer home environment for yourself or your loved one. And that's one of the greatest things about InHome Care, is that the supportive assistance and services that we're going to provide you and families, because we like to say that the care is not only for clients, but their family members too, is that we're going to help individuals stay safer in their homes where most people prefer to stay. Now, most home care, and specifically with ComForCare and At Your Side Home Care, we have clinical oversight that helps us identify what are those health-related goals that both the client and family want to meet, that kind of meets with RN oversight that can also bring in that background and expertise to ensure that we're creating the right safety net for your needs while receiving care in the home. Services can be short-term or long-term. Sometimes falls might result in a trip to the hospital, and so you might need to come home and recover for a short period of time. So that's where home care can become so beneficial in those circumstances, or in other ones where it just makes sense to have someone come in the home and alleviate some of the needs that are presenting themselves, so we can still work alongside our families and clients so that they can still benefit from living in their home and really engage in the care services that we're able to provide, like medication review and helping you adhere to those medications, and even look out for some of those medications that lead to falls. Our agencies are trained in fall risk management. In fact, we got training from Tiffany Schubert. And one of the things that she empowered us to look at and review when it comes to fall risk management is the way we screen, assess, and intervene. And those three approaches to fall risk management is so important because we have the right tools to help you identify, and even beyond the state-dependent brochure, what risk factors are presenting themselves in your loved one. And we're just screening, we're not diagnosing, but we can help you identify what additional areas you may need to go out and reach out into your community to identify different providers who can really bring really good solutions to manage those risks for falling. We can act as your advocate and also find those various resources within your community that you may not be aware of. And so really that's where InHome Care becomes the perfect partner for fall risk management. We make them a priority along with your overall healthcare goals so that you can remain in your home. And so recovery can become more manageable if you're coming home from the hospital, or even if you just need us for a few days a week to begin with. We're really flexible and always ready to pivot based on our approach, given your unique needs that are presenting themselves in the home, and ultimately what those goals are for both you and your family. Specifically to falls, we're really passionate about them. We have two goals. Number one, we want to create safer communities, and we want to improve your outcome. And the way we achieve that is the way we empower all members of the team. And most importantly, at the front line of that care team is our client. One of the most important things as a home care provider is that you work with someone that understands that. Because we're not here to change things, we're here to help support and empower you. And when we do that together, we help seniors stay in the community where they do best, out of hospitals, and ultimately reduce their risk of serious injury. Now, sometimes home care doesn't always make sense, or even staying in the home for various reasons. And that's where our partner Care Patrol comes into play, that can help you transition from your home to a community that makes sense, and specifically identify one that is specialized in prioritizing high-risk residents who are at risk for a fall. So as you can see by working with our company, not only can you rest assured that our approach is being given to us actually by Tiffany Schubert, she's helped coach us and really has educated us and imparted this newfound knowledge that we in turn want to share with you. That's how we can create safer communities, is not just by maintaining and retaining this knowledge, but by ultimately sharing it with our communities, which is why we're here with you today. So unfortunately, because when Tiffany first started this webinar, she did say that we're all at risk for falls, including myself. That's why we have a fall risk management program, not fall prevention. So we know that it's important to screen and assess our risk factors, much like a chronic condition, frequently and often. And when you don't feel supported enough, that's when it's the best time to reach out to a provider who does understand it. Now, what we did want to also talk about tonight is, in case of a fall happens, because it might, is we want to educate you on how to get up safely and properly. So we're going to welcome Tiffany back in on this conversation to walk us through how to do that safely, because it can happen. So we want to make sure we do it correctly so we don't further additional injury.
Absolutely. So, and I'm going to walk through this, and I'm going to actually recommend that if this is actually a great thing to practice, and it is a great thing to practice in a non-stressful, non-urgent situation. So we'll walk through the steps. I'm also going to recommend, there's actually some really good YouTube videos out here going through this, but you know, watch, you think about it, watch, and then practice. And there's actually, in some of the different fall prevention and fall risk management programs that are out there in the community, they actually have this as a component of those programs of getting on the ground and practicing getting up. So the most important thing, so this is typically what happens, you fall and you panic and you immediately want to jump up, or you immediately jump up. And I know people have all experienced this where, you know, it just happens and, you know, you're embarrassed and you're scared and you just go. Our flight or fight kicks in. And what you actually really need to do is stay still for a minute. You want to just take a couple deep breaths and just go, okay, I'm on the ground. I just need to pause. I need to regroup. I need to make sure I am not hurt, because if you are hurt and you jump up, you're probably going to end up back on the ground. So you take a few minutes, you go through your body real briefly, and just make sure you're not hurt. And again, sometimes we don't know. I mean, sometimes you go through and you're like, I'm not hurt. And then you stand up and you're like, oh, well, maybe I am. But just take your time. And then if you think you can get up, you're actually going to roll over onto your side. So depending on whatever position you're in, get over on a side and take a deep breath. And then you're actually going to roll into a hands and knees position. This seems, oh my God, really? It is actually an incredibly stable position for you. And what you want to do is navigate hands and knees. It's a little bit better than crawling, but sometimes crawling works, to a chair or to a sofa. Go ahead and go to the next slide, please. And then you're going to use that to help you. Chairs work the best. And you literally are going to put your forearms on the chair. And if somebody's helping you, as I slide out of my chair, this is the time that they really can help you. If you can get your forearms up, they can really help you with the rest. It's really difficult, especially if the person you're with isn't super strong. It's really difficult for them to lift you onto that chair. But if you can get up there, then they can help you with the rest. But you're going to get your forearms on the chair, then you're going to try to get one foot flat, and then you're just going to sort of slip your butt into the chair. This is why you want to practice it. If moving is not an option, call 911. It's worth it. And also, it really is a best practice if you can carry a mobile device, or a pendant, or, you know, anything in which you can easily call someone if you're by yourself and on the ground and need help. So,
Excellent.
yes, thank you.
Thank you. I appreciate that.
Sure.
So hopefully all of you have had a chance to gain some new insights and also have some tips relative to what resources are available to you should you feel like you need to build your team. So I'm going to go back to my original saying in terms of, so what do we do with all of this information? How do I manage it? So you took the first step by educating yourself, and that's a huge first step, because I can quite honestly tell you that there's a lot of lack of information out there relative to falls. There's a lot of published data, but we don't always talk about it in this way. So great job on educating yourself. The next step is, if you feel like you need to build a team and have someone take that additional step and screen even further, or even provide some of those supportive services, find your teammates. It could be home care, it could be community living, but it could be something like finding a good physical therapist who can come into your home to do an evaluation to see if you could actually benefit from some additional exercises that you could do in your home. And there's many, many resources within the community you could consider that a home care provider could assist you in identifying. The other aspect in how you want to manage your fall risk, because they do change over time, just like a chronic condition. So a lot of times I like to think of falls like diabetes. If you had diabetes, you continually check in with your condition to see how you're doing. Are you stable? Are you declining? Or getting better? And falls are really no different. And that's the type of conversation that we're trying to change relative to falls. So in order to always kind of check in to see how is my condition relative to falls, you want to use that stand-dependent brochure. Whatever your score may be, ultimately what we want to see is those numbers go down. And you can have those numbers go down and experience that by working with that team that you assemble around you. And sometimes it's hard figuring out exactly what that right team looks like. And again, that's why ComForCare and At Your Side can help you navigate things like that, is to help assemble what that right team looks like for you. The other aspect is, once you screen, assess, and even identify what your own interventions might be. In fact, you might have gone through this and picked up a few tips from Tiffany, like maybe I am on the wrong medications, or maybe I'm on too many. An intervention for yourself could be to simply go to your local pharmacy, bring your medication list and have them review it. Help identify, is there some that I could potentially eliminate? We do find that high incidence of falls are related to those that are on 8 or more medications. And sometimes we want to look at, is there an opportunity to reduce them? So that's what we mean by assessing risk factors, is not only identifying what those are for me as an individual person, but what can I do in terms of an intervention to minimize that risk? And then if appropriate, like Tiffany mentioned before, there's tremendous opportunity within the community that you can take advantage to build that strength and balance. Even if you don't feel like you're ready for that first step, just standing up out of a chair 5 to 10 to 15 times a day could really make a big impact that we as a home care provider can support, or you simply can do on your own. But check out your YMCA Silver Sneakers as mentioned, and some of the other community resources through your local senior center. It has a lot of these programs available to you that you just need to simply take advantage of. So we are here to help. We are your teammate. We take falls very seriously. We have professionals trained in home safety evaluation and can help you with that stay independent screening and even take it a step further if you need to. We have just a few moments, so I just want to see if there's a way we can squeeze in a few questions. Tiffany, do you think you have time for just a few?
Yeah, I'm good, thanks.
Okay, and what's quite interesting is that this webinar is really for our community members, but I also see that there's a lot of professionals by way of the chat and the Q&A. I can tell some of the questions are relative to professionals managing older adults, and then we have a lot of individuals on the line who are families with older adults that are at fall risk. So here's one question I'm going to ask you that's more for the older adult and our community dwellers, as you mentioned. So one of the attendees has shared that their loved one experiences a lot of wooziness in the middle of the night and has actually fallen before. And I actually hear this a lot myself from families. And so any suggestions or strategies on why that might be happening?
Yeah, so I mean, again, there's always multiple risk factors, but the main thing is, especially if you're feeling a little, the whole wooziness usually means that there's probably a sleep medication that's involved. And when we say sleep medication, doesn't necessarily need to be prescription. So I mentioned Tylenol PM earlier, but very few people actually know that the PM is diphenhydramine, which otherwise known as Benadryl, which is actually what we call strongly anticholinergic, which means it really slows down the way our brain works. And so it's really common for like, hey, I'm having a problem sleeping, I'm gonna take a Tylenol PM, but then when you wake up to use the bathroom and your brain is literally working slowly. I mean, it's actually one of the few medications that is actually the relationship between Benadryl and falls risk is so profound that it's actually listed on one of the Beers criteria to not take. So that could be one thing. And then the other thing just in general is making sure you're getting good sleep and you're practicing good sleep hygiene. You're really slowing down. First of all, you're physically active during the day, so you're tired. And then secondly, at the end of the night, you're really doing all of the right things so your body gets the rest it needs. And then the final thing is, if you think about it, you know, making sure that path from the bedroom to the bathroom is as clear and clean as possible. And that you got it lit in such a way that if you turn on the light, it's not going to blind you, because that'll definitely impact your ability to stay on your feet. There's a lot of really cool products out there that motion sensor lights that just light up very little bit. So
what about blood sugar? Does that impact sleep and when waking up and causing that dizziness or confusion? Do you see any correlation?
It can. It's not really an area that I've got a lot of experience in, but it definitely, I mean, we definitely know if our blood sugars are low, or if we're not managing our sugars right, or if we're getting a lot of variation, that can have a huge impact on our brain and our metabolism. So we really, I mean, we think about it usually a little bit more with exercise, but it can absolutely be impacting. And also there's certain medications, especially a lot of medications around managing your blood pressure that could interact with the medications to help manage your diabetes that can actually result in a hypoglycemic event.
Okay. And again, if those feelings are being experienced in the middle of the night, or someone has fallen in the middle of the night, that might be a great time to go back to your physician, have those medications reviewed, do some blood work, and really start identifying what could be causing this. And we like to say, get to the root cause of what's causing that wooziness at night, because that's not normal.
Exactly, exactly.
Okay, I think we have time for one more question. I see that there's quite a few in here. So thank you to everyone. We just have time for one more, unfortunately. You do have my email address here, so please feel free to shoot me questions if you have it. I do want to let you all know before I ask this next question that everyone here will be getting that Stay Independent brochure. So know that that will be at your fingertips here soon. Last question. So I have here that that came in that a loved one recently was diagnosed with dementia. And as a result, they've noticed that their loved one has fallen, which never before experienced at all. So they're curious, is this their new normal? And does this require screening like we've talked about today?
Yeah, great question, and definitely a very challenging situation. So what we know about, and unfortunately, dementia can mean a lot of different things.
Mm-hmm.
So, so I've got to temper my answer a little bit around that. Depending on the type of dementia, if there's an impact on how the individual is perceiving their environment, it's going to have a huge increase on their risk of falling. Just a simple example is a lot of times when we start in the early stages of Alzheimer's disease, we're easily distracted, have a hard time focusing. And if you're easily distracted in your environment, you're not going to see the step in front of you. You're not going to see any object. So that's really common. A lot of times what we think about when we're working with older adults with any stage of dementia is, how do we keep our environment as consistent as possible and as safe? And I want you to notice I said consistent first. I've had situations where my patients' caregivers have been like, oh my gosh, we have to make the environment as safe as possible, and they move all the furniture. Well, guess what? That person, that older adult, had their mental map of the furniture. And so once it got moved, they actually fell because they knew that the table was right there, and they were going to put their hand there, and suddenly it wasn't. Mm-hmm. So we try to keep the environment as consistent as possible. We actually work a lot on strength training as well. And also we just become very aware of what are some of the triggers that can impact attention. So don't have a conversation when you're walking with someone. Don't have music blasting and multiple things going on. So how do you create that environment to keep people on their feet? But when you aren't perceiving your environment, your risk will go up. But there are things you can do, and you should screen. Okay. And the final thing is medications as well. As you're starting new medications for dementia, that can have a big impact on your falls risk, so being aware of that.
Okay, terrific. All right, Tiffany, thank you so much. I really appreciate your time, of course, as always a wealth of information. We could probably listen to you all night. And thank you to everyone for taking time out of your evening and late afternoon on the West Coast for joining us. Like I said at the beginning, I applaud you for taking this first step. It's really great to start educating yourself about falls like you would any other chronic condition. Knowing that age does not mean it's the inevitable factor to falling, and that there's a lot you can do. It just really starts with screening, assessing, and intervening. And if you need help along the way, that's what we're here for. We are part of your team. So find your teammates and know that you're not alone. Thank you again. Thank you to all of our offices around the country who assist in fall risk management. And again, thanks to all of you for joining. Tiffany, of course, as always, thank you. We hope to bring more educational programming to you soon. Everyone who registered and attended, you will be contacted to have the Stay Independent brochures shared with you. And if you need any additional resource or information, we're here to help. Thanks again, and good evening.
Thank you all. Have a good night.